Here's what Dr. Herz advises diabetics when it comes to eye care.
It is recommended that people with diabetes get their eyes checked every year. Even if they're diet controlled, they should still have it done once a year.
No matter what age they are.
No matter what age they are. But the things that I'm looking for are any sign of abnormal blood vessel growth, whether it's in the front part of the eye or in the retina. You can get bleeding in the retina or swelling in the retina, which is called retinopathy. And especially if the swelling is near the center of your vision or the macula, that's really important to look for that and watch for that, because that's what can cause people to start to lose their vision. But also cataracts grow faster when you have diabetes. So those are things that I'm watching for, and also because of the way that diabetes affects the oxygen delivery to the nerve tissue in the eye, it can also put you more at risk for glaucoma.
Wow, so there are a number of things that having diabetes really can affect the eye.
It's not
for a number of different reasons.
Yes.
So annual eye checks are so important.
Yes.
And that way you can pick these things up early.
That's right.
Yeah. So if we focus more on the retina, which is like the light falling on a screen, right? So we see off of that screen. So tell us, what is the treatment if you're starting to see new blood vessel growth or swelling in the back of that part of the eye?
Yeah, so when I'm doing a dilated eye exam, I am looking very carefully at the macula to make sure there's no sign of swelling. But I'm also scanning around the rest of the retina too to make sure there's no signs of little areas of bleeding. Because if I see the beginnings of that, if it's in just one little quadrant, that's considered to be mild retinopathy. But if it's in a couple quadrants, then moderate and to severe, or even to the proliferative, it's called, type of retinopathy, where you're having abnormal blood vessels growing because the retina is not getting enough oxygen through the regular blood vessels. But you're looking for all of that because in the beginning stages, it gives you a warning that you've got to get the blood sugar better controlled or the retinopathy will progress. And they have shown that if you can lower the hemoglobin A1C, which is an average of your blood sugar over 3 months. But if you can lower that by 1 point, you can slow down the progression of the retinopathy by 35%.
Wow, that's a huge gain. For often, if you're out of control, 1 point isn't too difficult to achieve, really.
Right, right. And I like to encourage my patients, because I know that it's a daily battle for keeping that blood sugar down. But it does help. It's not just their eyes, but it does help to save their vision. The lower that they can keep that A1C, the better chances they have of not having any retinopathy or other eye problems from diabetes.
So if you have diabetes for a long time, you don't have to get the retinopathy.
That's right. That's right. I have seen a population of patients who unfortunately didn't get regular health care, either regular eye care or regular physical exams with their medical doctors, and a lot of them did have retinopathy because it hadn't been well controlled, and a lot of them lost their vision either from this neovascular glaucoma or from swelling in the retina. But I see another population of people who do get regular visits with their doctors and see their endocrinologists, and they keep their hemoglobin A1C down in the 6 range. I know that everybody wants for it to be even lower, but I mean, seriously, they keep it in a good range. And they've had it for 20 years or more, and they don't have any retinopathy, which is really wonderful. It shows that it works to keep it under good control.
Right. Now, you're talking about vision loss. So people can go completely blind with diabetic retinopathy?
They can, unfortunately. It can be very severe, and people can completely lose their vision in one or both eyes.
Can it happen very suddenly in diabetes? Is there ever an emergency situation where they might be able to actually salvage that by seeking help straight away?
There can be emergency situations. I mean, typically it's more of a gradual thing, that if you're doing your screenings, you can catch it and stop it or slow it down with certain treatments. But because of the way that it affects the blood supply to and from the eye, it can put you more at risk for a stroke to the eye, where you would suddenly lose vision. And it can put you at risk for that type of glaucoma I was talking about, which could happen all of a sudden, and the eye pressure go up, and they would have a very severe headache and blurred vision. And there's treatment that, if you get it done right away, may save the eye, even in those situations, even though they're advanced.
So a sudden unilateral headache just with
Blurred
that
vision, eye would be very red and painful.
And so that is an emergency. They need to see an eye doctor immediately,
Right.
and their vision may be saved.
That's right. That's right.
Now, tell us about the cataract side of diabetes. What age do people start to get cataracts with diabetes?
The average person will start to get signs of cataracts in the early to mid-50s, but depending on how long you've had diabetes and how good of control it's had, it's possible to get it sooner than that, even in your early 40s. But it makes the type of cataract that you have progress more quickly. So that if the average American needs their cataract out when they're 75, somebody with uncontrolled diabetes might need it out when they're 50.
But they'd still be able to have that done and still have their vision restored.
They would. So cataracts are still very fixable, whether they're due to diabetes or due to something else. The main thing would be with somebody who's diabetic, if their nerve tissue is still healthy and they don't have retinopathy, then it's going to restore their vision. But if, in addition to a bad cataract, they also have nerve damage from the diabetes, then taking the cataract out may not restore their vision.